Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Diffuse esophageal spasm, we will see the pathogen clinical features of diffuse esophageal spasm. In the clinical features of diffuse esophageal spasm, the patient with diffuse esophageal spasm presents with chest pain and dysphagia. Actually, there are multiple contractions, repetitive contractions are seen which are of high amplitude. So, as a result, they will compress or they will compress the blood vessels. Thus, the patient will report chest pain and dysphagia mainly after eating, or it is related to eating and exertion. And the patient will also complain that there is sudden pressure of the chest is seen, and this sudden pressure of chest or chest pain is radiating to the arms, jaw and upper back. So here the symptoms are present mainly are also aggravated with the emotional stress. So it is mimicking myocardial infarction, right? Even in myocardial infarction you will see chest pain, which is a squeezing type of chest pain which is radiating to arms, jaws and upper back. But the main difference is it is also here in esophageal spasm, it is related to eating also.
thank you and thank you for watching.